I am Dr. Waseem, and now we are discuss how we can differentiate between hemangioblastoma and juvenile pilocytic astrocytoma. Both lesions are infratentorial and are present in the cerebellar region and appear as cystic lesions having a solid component. So, if a cystic lesion is present in the cerebellar region or in the infratentorial brain and mostly cystic having a solid component, then it can be either juvenile pilocytic astrocytoma or it can be hemangioblastoma. Now, how we differentiate whether it is juvenile pilocytic astrocytoma and hemangioblastoma? The most important feature is the age of the patient. Juvenile pilocytic astrocytomas are usually present in children under 10 years of age, while hemangioblastomas are usually present in adults greater than 40 years of age. So, after age, the next feature is the enhancing mural nodule. In both juvenile pilocytic astrocytoma and hemangioblastoma, there is a solid component which enhances after post contrast imaging. Now, how we differentiate whether this enhancing component is the juvenile pilocytic astrocytoma and hemangioblastomas. In hemangioblastomas, the enhancement is very homogeneous and avid enhancement. There is extreme enhancement of the solid component. And in juvenile pilocytic astrocytomas, there is enhancement of the solid component, but it is not as avid and as pronounced as in the hemangioblastomas. The reason is that in hemangioblastoma, the solid component is basically the endothelial lined malformed vessels. So, hemangioblastoma is the tumor of thin walled endothelial lined blood vessels. So, in hemangioblastoma, the enhancement is more pronounced as compared to the juvenile pilocytic astrocytoma. The next we can differentiate with the angiography images. When angiographies of the brain is performed in hemangioblastoma, we can see a feeding artery which is supplying the malformed vessels, and sometimes we can also see a draining vessel or draining vein, and there is avid and there is aggressive enhancement of the solid component of the tumor in hemangioblastomas. In juvenile pilocytic astrocytomas, the nodule is not as much hypervascular as compared to the hemangioblastomas. So the other most important feature is the pile attachment. Juvenile pilocytic astrocytomas are not attached with the pile surface of the brain parenchyma, while hemangioblastoma is attached usually with the pile surface of the brain. And in hemangioblastoma, there is association with the von Hippel-Lindau disease, but in juvenile pilocytic astrocytoma, there is no such association. So these are the few differentiating features between hemangioblastoma and juvenile pilocytic astrocytoma, although they both appear as infratentorial cystic lesions having a solid component.